Awesome. Maybe we'll go ahead and we'll get started. People kind of roll on. So a few announcements. Maybe Amelia, you could take it away in terms of the member survey that we've been sending out to folks.
Yes, we're really excited. We have a survey that we're going to send out. I'll put a link in the chat here in just a second. We want to get your feedback on what you guys are hoping for from our SIG, what topics, things like that. If you're like, oh my gosh, I'd love to present on this, please fill that out. It is completely anonymous. So if you do want to share something or you really do have something that you're excited about, please put some contact info in there so that we can reach out to you about it. Otherwise, totally anonymous. You can tell us what you're looking for, or you can reach out. I put my contact info on there as well, so you can reach out to me privately if that's how you want to connect as well. We're excited to hear what you guys are looking for.
Awesome. Thanks, Amelia. And yeah, you're always welcome to email us in general, but we thought this could be a nice way to, you could give some anonymous feedback, or anytime you're interested in presenting, we're always looking for presenters for that this is how we do it, but also our member spotlight, which is new. And so, please feel free to reach out to us, and we're excited to hear back from everyone. Let's see. Our next meeting will be May 6th, topic pending. And as always, if you have any job announcements, please feel free to put it in the chat. We'll put it into the minutes as well to get out to the larger group. So, I guess without further ado, we can go into the member spotlight. And so for those of you, we've been kind of starting to do this to we've grown, I think, as a group, and there's many new people just want to spotlight the people who have been coming consistently. And so one of the people who are going to do that today is Carly Geisler. So we're happy to hear from her today. Hi.
There we go. Now we have sound. Good morning. Yes, so I didn't realize just how new this was, but I'm happy to be kind of guinea pig new. It's fabulous. So as Liz Davies down there shouted out earlier, I'm one of the Montana folks joining today. So Carly Geisler, I'm a psychologist, a pediatric psychologist. I work at Benefis Health System in Great Falls, Montana. Benefis is a nonprofit independent healthcare system. Although we're not an academic medical system, this past summer, we did welcome our first class of medical students at a sister medical school called Toro. So that's very exciting. We're going to get a lot more med students kind of rotating through our clinic, which is awesome. Benefis is new to integration efforts. We currently have a grant through the Montana Healthcare Foundation for integrated behavioral health. They've provided support to clinics, hospitals, FQHCs around the state to develop sustainable programs within their settings, working strong efforts, which has been awesome. I work as a behavioral health consultant within our pediatric primary care, using the PCBH model of integration. As all BHCs are, I'm kind of a woman of many trades within our primary care system. Our clinic sees newborns to 18, so we get a full range of presenting concerns. And as the first BHC in our system, I've worked with our team to develop the program pretty much from scratch. So the first task that I kind of took on was helping to improve behavioral health screening processes in our peds and family med clinics, which has definitely helped create some natural pathways for BHC utilization, which has been great. We actually are using kind of a broadband screener as early as 4 years old. And so we're catching a lot of things much earlier, and so that's been fantastic. Obviously we screen as early as 1 month using the EPDS and things like that, but it's a lot more consistent and standardized, and so that's been a pretty cool process to watch. And then something I hope to continue to get out of the Peds SIG meetings is really community, and continuing to expand my knowledge of what others are doing in the field and other places. And I'm a big proponent of being a lifelong learner, and this is a great place to learn. So thanks for having me.
Awesome. Thank you, Carly. And it's great to hear about the work that you're doing and starting up from scratch, which, can be a lot of work. So I'm glad that, you're here to learn and hopefully, feel free to, if you have any other kind of areas of interest that you'd love, for us to talk, present on, we'd be happy to hear back on that. Okay. Well, it looks like Jonathan is here, and we're going to segue into our topic area of the day, which is going to be a presentation by Dr. Lesley Manson on long COVID in pediatric patients. And before we get into her awesome presentation, Jonathan is going to kind of set the foundation in terms of talking about a research article. So I'll segue over to him.
Thank you. Hi, everyone. Hope you're doing well today on April Fool's Day. And thank you, Dr. Manson, for presenting today. I will share my screen here just to give a brief introduction to some of the stuff. Let's see. All right, so I'm assuming you can all see this, okay? So today we'll talk about briefly a systematic review and meta-analysis on the prevalence of mental health problems among children with long COVID. So as far as the background, most COVID-19 research has focused on its direct effects on adults, leaving a gap in understanding the mental health impacts, especially among children. However, since the COVID-19 pandemic, the prevalence of depression and anxiety has more than doubled. Long COVID, characterized by symptoms persisting beyond 4 weeks following a COVID-19 infection, may represent a risk factor for mental health problems in children. Therefore, recognizing this association could lead to an increased awareness in screening for mental health issues following a COVID-19 infection, therefore facilitating earlier intervention, potentially reducing morbidity. The systematic review and meta-analysis was conducted to assess the prevalence of mental health issues following a COVID-19 infection, and when possible, comparing those rates with individuals without a history of a COVID-19 infection. It looked at studies published between 2019 and May 31st, 2022. It reviewed 7 databases using the same predefined search terms. It included observational studies and intervention studies, and all primary outcomes involved mental health symptoms or treatment of anxiety or depression in children with long COVID. Out of all the 1,848 studies screened, only 13 studies met criteria for this meta-analysis. As far as prevalence rates across the studies, there's 13, and usually there's about 3 studies per outcome, a couple more for some, but about 3. So keep that in mind, kind of a small, not too many studies here, but basically found that studies that included anxiety as an outcome showed a 9% prevalence of anxiety in children with long COVID, 15% prevalence of depression, 6% prevalence of concentration problems, 9% sleep problems, 13% mood swings, and 5% experienced appetite loss. Of all those outcomes, there was a statistically significant difference between those with a COVID-19 infection and anxiety, depression, and appetite loss. They were more likely to experience it than those without. And as you see here, so again, children with the infection were more than twice as likely to experience anxiety and depression and had a 14% higher likelihood of experiencing appetite problems than those without. However, they concluded that across all studies, there was a lot of sampling differences, and there was also a lack of data from lower or middle income countries, which could therefore limit the generalizability of these findings. As far as the conclusion of this, basically, the authors found that anxiety, depression, and appetite problems were significantly higher in those who did contract the COVID-19 than those who did not, possibly due to long COVID. And this really emphasizes the significance of screening and early intervention for children following a COVID-19 infection, particularly during the 1 month and 3 to 4 month post-infection period. That's the kind of long COVID range, and also that's where all the studies evaluated their outcomes as well. And therefore, utilizing validated questionnaires is essential for optimal detection, which can facilitate timely intervention and prevent future complications, including morbidity potentially. And that's all I have for this brief introduction. Thank you. And now I get, well, if Dr. Pets would like, want to introduce Dr. Manson.
Absolutely, yes. It's my pleasure to introduce Dr. Lesley Manson. She's clinical associate professor in the College of Health Solutions at Arizona State University, and also one of the individuals who founded the SIG several years ago. So one of the founding members and previous co-chairs. So we're really happy to have her back.
Yay. I'm so glad. I love this SIG. So thank you, everybody. It's really great to be here. I may turn off my camera. If you all hear glitches, let me know. Earlier, you all were glitching for me. Right now, it's smooth, but there's a storm in Arizona. So, although it's 85 out, overcast. So, now we have problems with internet. So we're going to be discussing mental health impacts for which are related to long COVID and specifically also within the pediatric population. As Jonathan noted before, there is this kind of mix in what we're looking at as far as the research. We can't really say, oh, hands down, this is it, because there is lots of different definitions related to long COVID. There's lots of confusion of whether or not someone even had COVID, right? And when we do look at the studies that have been done in like 21, 22, and they looked at very specific populations. Even those studies also have a lot of faults and missing information and missing populations. So some of the data I'm going to discuss is related to adult symptoms of long COVID and how that works. And then I'll also kind of talk a little bit about the pediatric pieces and then some of the pieces related to the recommendations for medication. I won't go into those because I don't do psychopharmacology and prescribing related to that, but I'll let you know some of those pieces that are there. And I know Dave Haddock is on as well, and Dave has been part of our long COVID Echo, and we also have a free long COVID education Canvas shell that's going to run free with free CE CME for everyone until I think the end of somewhere in May. So what I'll try to do is get those links and send them to you in case folks want to go in and just go online and look at some of that education and get some free CE CME through our course shell that's open. Okay, but let's go ahead and dive in. Hey, we're here to learn a bunch of stuff. And when we're thinking about long COVID, I just want to say long COVID technically encompasses about 200 or more different symptoms, and they're variable and wide ranging. Okay, so it's not like we can say, oh, it's definitely these three things that you have X percentage of the time. And that makes it really difficult for not only identification, but also sometimes treatment. Right. And we're talking about multiple symptoms, including respiratory, cardiovascular, musculoskeletal, gastroneurological, dermatological, and of course, mental health symptoms. Right. So it is really important that folks recognize some of the big recommendations that are coming out, which is related to screening and making sure that we're asking the first question of whether or not this this child has had COVID within the past X amount of months or within the past month to 3 months prior to the symptom onset or the change in symptom severity. So that's really important. That's a question that most people are not asking. And when we're seeing this and we're seeing just changes in severity and complications, we really want to try to check in on that. Now, the problem is that most people aren't even testing anymore, right? So we don't really know for a lot of folks if that's occurred, but sometimes they may say that they had some sort of a cold, flu type of symptoms at some point, which can help us a little bit in this to kind of look at what we're dealing with. Okay? But we do want to just kind of note that the evidence of incident of long COVID, it ranges. So meaning just getting long COVID, we see percentages of everything from like 3% up to 25 to 30% of people experiencing symptoms. And again, those symptoms would mean that they had symptoms that are occurring between 1 and 6 months after the experience of COVID. And I'll talk about how there's some running different definitions too, which doesn't help our scenario as far as the CDC, World Health Organization. They actually give different criteria for long COVID. So it's like, oh, wonderful. This is why even more we're kind of confused. In addition, we're seeing just in general, most of the population having mental health symptoms 10 to 35% higher than the general population. Okay. We're seeing a lot in anxiety and depression. increase. Now, when we look at it since the pandemic, there's a variety of reasons why we are seeing these. So some of this is related to pandemic fatigue, other types of just general global world, changes that have been occurring. And so that's really just important to note, is that although we can see this and kind of make assumptions that tie to long COVID, we also know it's embedded into a world that's really changing. And as far as our kids and what they see as far as every day and what's happening for them. Okay. But we also, so we can't like ignore that piece, right? We also want to kind of make note that with the pediatric patients that they could, after COVID-19 infection, have some symptoms that resemble what we call MECFS, which is myalgic encephalomyelitis. Why am I losing this now? I say it 30 million times before, with chronic fatigue syndrome. And so that's really important because we know some stats on that the symptoms related to MECFS, those symptoms blocks have not changed. Prior to COVID to after COVID, the symptoms are still the same. We just see a significant increase in identification of those symptoms. So that's what leads folks to say this could be part of long COVID, okay? So it's just the frequency is increasing, but the symptom picture looks the same, okay? So they're not saying, oh, this looks different. It's actually, it looks very much the same. It's just the symptom picture as far as the frequency of identification is increased in our populations. We see lots of different symptoms as far as hospitalization and changes post-hospitalization and mental health symptoms. These are a mix of adolescent and adult studies that have been provided for long COVID. And so it is really important to recognize that most of the symptomatology will start to decrease. Typically at about 12 weeks, there's a significant decrease in symptoms. For some folks, it will continue to linger. And so we have seen folks that have long COVID symptoms past 3 months, right, going into 6 and into a year. Okay, but overall, the occurrence continues to decrease systematically for most folks. There's also many reasons that they could be decreasing, everything from obviously treatment, impacts to also vaccination. And so those things are really important to recognize. Still to this day, vaccination still is the #1 recommendation. Now, you do always want to consult with primary care or other specialty care, especially if a child has complex issues, because they also have seen with some of the new boosters, some difficulty with some of the complex issues. So some folks are actually kind of being a little bit more tight related to their recommendations on certain populations. So just so you know, that's been a change this year versus last year. Okay? They are expecting that perhaps next year or this year, later on, it may look a little bit different and they may actually increase some of their recommendations again. So that's just going to be what we see when it comes out and what's happening with it. Okay? So just for people to know too, some of these impairments, as Jonathan already reviewed, we see a lot of impairment, especially in kids with fatigue, kind of headaches. We also see this depression anxiety mix that is occurring, and of course some cognitive impairment with difficulties concentrating and really being able to sustain in general things like that they've done before, like sports or school or work environments. Okay? So we know that long COVID actually interrupts lots of areas of our health. And so it really is important that people understand that there's a lot of reasons for this. There is kind of a working hypothesis that's been formulated that one of the reasons why long COVID impacts so many of our kind of health symptoms is because it impacts the central nervous system. So they believe that it has both direct, so viral invasion, and indirect inflammation, hypoxia, vascular dysfunction, and all of that is impacting the mental health symptoms. So that's really important to recognize. It's how the body is working overall, right? It's not like, oh, it's just this one piece or one thing, or this one event that's occurring, okay? We also see that it's a systemic immune dysfunction. So including both neuroinflammation and autoimmune dysregulation. And so that's part of what's also been discussed, and having elevated inflammatory markers. And that is noting what's happening for these kids and what we're seeing in some of these big changes. So we also see neuroimaging and EEG and how they've actually demonstrated structural and functional abnormalities in the frontal, temporal, and limbic areas of patients with long COVID. And so again, if we're having these changes, these considerations, obviously we're going to have these symptoms, right? So it's very direct when now we're able to look at what's actually happening, okay? There's very specific inflammatory markers that they're looking at, okay? And that's those IL-6 and TNF alpha. And those actually increase the risk of post-acute symptoms. So it's really important that people understand that there is a lot of research happening with this. They're actually diving into more testing related to this. And there's ongoing large studies right now across the United States and in some other countries related to pediatric populations with long COVID, although those studies haven't actually given us a lot of information yet. And I know that they are getting a little bit more funding, so we're hoping that they come out with even more information. Actually, in Arizona is one of the places for some of those studies. So we'll see if hopefully in the next year we get even further information from that. We do know that if you're thinking about looking at kind of your lens of populations that you might be seeing, there might be specific populations that are going to have an increased risk in some of these symptoms. And so it's important just to kind of look, okay, here's those basic, areas that we want to look at. So anybody who, of course, has been ever hospitalized related to their COVID-19 symptoms, anyone who's had what we might dictate as more severe symptoms, they've had longer duration of symptoms, so they were testing positive for longer periods of time. And then, of course, anyone with pre-existing mental health conditions. And then we also have very specific, notes of specific populations like women, individuals who are Black, Hispanic, or Latino, American Indian, Alaskan Native. So it's really important to know if you're working with any of these populations that, again, we might want to consider these types of questions, especially if there's been a change in their symptom picture, an exacerbation of their symptomatology, or maybe even just feeling like people are getting stuck in their progress. Then maybe this could be something that's underlying that feeling of them being stuck. We also have seen a huge change in individuals with intellectual difficulties and disabilities. In fact, COVID-19 was the #1 cause of death in 2020 for those kids, adolescents, and adults. So that's a really big one. So if you have an IDD, population that you're working with, that maybe this is something that you really do want to put on the list and maybe even test for with that population on a regular, because of the significant changes for them and their difficulty with being able to really manage some of this post their COVID infection. Okay. Oh, come on. There we go. We also understand there's lots of other reasons why you could have these symptoms, biological mechanisms for mental health symptoms, etc. So it is important to kind of, understand that and know that even with long COVID, we actually have seen an increased risk of suicide. Again, it's also could be because it's coupled in this pandemic and then post-pandemic changes that have occurred for our children and adolescents. And so it is really important to just kind of monitor for that and realize that, because when we look at some of the studies, regardless of COVID status, we saw that there was up to 53% more likely for people to have an increase in symptoms of depression, anxiety, and PTSD and suicidal ideation. So, again, pandemic effects. Does that make sense? So this is why sometimes it does get a little bit hard to differentiate and weed out a little bit of this. Is it long COVID versus is it mental health changes post, the pandemic in general? Okay. Why am I clicking? It doesn't seem to be working. Okay. Aha. Sorry about that. So one interesting piece that I like to talk about when it comes to long COVID and adolescence is a study that occurred, which was an MRI study. It occurred in 2016 to 2019. And it was just interesting. It had nothing to do with long COVID, right? But they were doing an MRI scans comparing teen brains, okay? Then the pandemic happened. And of course, the researchers were like, we've got all these, MRI scans. Like, why not we start doing it again in 2020 to 2022 and see, do we see any differences in the MRIs? And this is a normal thing that researchers have done, is this very specific study will take a few years of MRI studies and then look again, see, oh, how are we maturing and changing, right, as populations? What could be impacting that? So it just happened to have a large amount of that study starting in that 2016, 2019. So again, they took this opportunity to then go, oh, now let's do it. And so they did. And so they actually saw some very specific pieces, which were really concerning. So there was noted an unusually high growth in the hippocampus and the amygdala. So those are your areas, right, of memories, regulation of fears, emotions, right? And so if you start to think about this, like, okay, now I can see why there could be some changes here and some symptomatology differences. They also saw a higher volume in these areas tied to behavioral disorders, right? And so when we're thinking about all these things, we're going to put it all into perspective that perhaps COVID and the pandemic has actually changed structurally how we're actually working as individuals and how our brain is operating, which is very interesting. But for those of you who understand kind of with PTSD and what we know about, how trauma impacts the brain structurally and physically, right? It's not uncommon to understand, okay, this is what's been happening too for adolescents and pediatric populations. So they also saw a higher than expected thinning of tissues in the cortex, okay, and that's involved with executive functioning. And they actually saw that these teens had what they called more advanced brain age. And then, of course, they saw what they would say is more symptoms of anxiety and depression when they were talking to them. And they said, this is, again, much more significant than ever before in our generations. So it's really important to, again, recognize how this actually could be something that has just occurred for our populations in general and kind of set this new stage for us. Okay. There are some other kind of research out there that you can look at. I'll just mention it because it's fairly new and there's not a lot of evidence in it yet. But there is some research out there that found that tryptophan absorption is reduced with the inflammation post-COVID, and that serotonin is depleted. Okay. And in specific, they're saying that's leaded to disrupted vagus nerve signaling, which in turn can cause kind of this several of symptoms associated with long COVID and memory loss and mental health problems. And so they've actually been trying to look at a very specific use of SSRIs and SNRIs to really help with post-COVID symptoms. And so you'll see a lot of, kids that they're suspicious of post-COVID getting on now SSRIs and SNRIs. A little bit more easily, I would say, than in the past because of the black box warnings, because when they've looked at some of the increases in use of SSRIs, what populations are saying that overall it's improving lots of other symptoms because they really believe it's this piece and functioning in the brain. Okay? But again, okay, this is very new. This is not saying that anybody should do this. And again, most people are operating off of the best practice. This is just what we've got. We don't really know. We're trying to look at it. Let's try to see. And of course, we're still looking at the pediatric dosing at the lower levels. So for pediatric dosing, so starting subtherapeutic, right, and moving on up, just for people to know. They did do a small study with adults, and they did noted in specific that just with SSRIs, that patients had significant improvement in memory, significant improvement, of course, in anxiety, depression. And so that's part of this movement toward really starting to look at our pediatric population in this as well. Okay? But it's interesting about the MRIs, and I'm sure they're going to do a lot more, especially with the larger studies that they're doing right now with the research. Okay? So defining long COVID, this is kind of what Jonathan had noted earlier. We do have kind of some changes between the CDC and the World Health Organization. And so if the symptoms are kind of going over 1 month, sometimes the CDC goes, okay, long COVID, name it. If the symptoms are over 3 months, that's what the World Health Organization recommendation is. And so you'll see that a lot, okay? And then if the symptoms are occurring over 6 months, okay, and the frequency and the duration is continuing to increase, they're saying right away, look at the ME-CFS for kids. So making sure that we're not ruling that out and someone's actually sending them to specialty to really look at the symptom picture. Right? When we look at those symptoms, there can be so many symptoms that folks are coming in, just so many. So it is really important to recognize everyone's different. Some folks are going to have more of what we call like the medical sequelae. So you might see folks with more of those like headaches, especially young kids, gastro problems, a lot of stomach aches, pain or muscle tension. They might also have some symptoms of POTS. So different types of like sitting up, standing, they might start to feel anxious, and it's really actually changes in their heart rate and blood pressure starting to occur. And so some of them will actually pass out or fall down or get dizzy. Okay. So all these are part of these symptom pictures to really kind of look at and look for. So just making sure that if you are working with kiddos, especially if you're seeing them more for the mental health aspect, and perhaps just kind of checking in to see if there's any of these other types of symptoms that might be occurring. Again, the Recover study is that big study that's going worldwide and mostly in the United States, supported by the federal government, but there's other countries in the EU that are also supporting it. And that's that study that we haven't seen much out of yet. But it's always good if you are working with these kiddos to get connected to Recover. And perhaps even refer kiddos there if there's a study center near you. They're mostly at university hospital centers right now. Okay, this, I just wanted to show a little bit about how these symptoms are moving. This is actually from the UK, but thinking about how the UK, they had about 48,000 pediatric cases, okay? And, thinking about the UK is like 1/5 of our population. It's really good to kind of like consider, wow, here's what they've been seeing or they saw, right? And so that's really important to go, okay, maybe we should be thinking about this. Because again, we don't have a lot of good solid research yet to really say this is from the US, right? And so I think it really is good to kind of think about these. I will send everybody, I'll shoot you my slide deck and the references at the end so you can look up the studies and kind of check them out a bit. But again, it's just something to consider, okay? And again, we see symptoms that are declining over time, of course. And so it is important that we recognize that as of right now, we are very hopeful that these symptoms will be going away for most people, okay? So we do need to kind of make sure that there's this clinical evaluation for ME/CFS, okay? And we actually had a pediatric specialist present in our long COVID. And so the next two slides are from him. So just kind of giving you a little bit of some of the labs that they do and what they're seeing related to it. And again, the symptom picture has been very specific related to this. So that hasn't changed as far as what it looks like. Okay. There are specific labs that you can request for it. Okay. And so these are some of the hyperflexibility. Okay, so these are some of the pieces that they're seeing for folks. Okay, and so it is really important to kind of note there are very specific scales and tests that people can do. Okay, they can do a Benton score. Okay, and that's looking at very specific. It's a very specific test that is looking at joint hypermobility. Okay, and looking at what we call hypermobility spectrum disorders. Okay. Okay. So it's really important that we look at vascular disorders and symptoms. And so often you're going to see this if you are kind of in your history, you've seen a lot of adults as well, maybe adults with diabetes or other types of conditions. Maybe you've seen some of these pictures more related to that. But unfortunately, now we're seeing some of this in children. Okay. And so it is really important that we're looking at this because, although you can think it's kind of like a benign issue, it does cause discomfort. It does reinforce the symptoms of depression and anxiety for our kiddos. They often feel like they look different, right? They often feel like that they will be different in school. And so they're more likely to really not want to go to school or not want to participate in sports anymore. because they have reduced blood flow to their extremities and oxygenation is not the same. So just kind of recognizing this, there is very easy treatment. They're all very specific, related to more lifestyle changes and factors and things that really they refer to more like behavioral health providers to really look at and help with that. Okay. Okay. Again, pediatric populations are going to be experiencing ME/CFS. Okay. And it's really important that, you know, we just kind of make sure that we understand that this is and could be something that folks may end up getting a more longer term concern from. Okay. And when we're looking at this, one of the things that they're looking at the most is orthostatic intolerance for the kids. We see it the most in adults, okay? But that is something that they're seeing now with some of the kids that have been really identified as having more complexities after having a COVID infection. Okay? So just kind of looking at pharmacotherapy, what's really, so these are some of the areas that they're looking at as far as treatment for kids, okay, and adolescents and adults, to be honest, okay. One of the big things that they are doing is allergy medications. And so you'll see that a lot in kind of the literature and the most recommendations. So you're seeing folks being sent to specialists, not only getting on very specific allergy meds at high doses, and also considering allergy shots, and they're having a significant change in their symptoms from that. Okay. So that if you are treating kids with long COVID and they have not looked into that, which would be odd at this point, but I would encourage your treatment team to look into some of those pieces and what they're doing, because that could be something you could add on. Okay. There is very specific treatment for ME/CFS. So it's important to just kind of know some of those pieces. Again, some of that's postural, very behavioral mechanisms, okay? And a lot of it is about treating kind of the symptoms, right? So looking what can you do behaviorally to treat symptoms, what you can do as far as each of the different pieces of it. So not only looking at, okay, pharmacotherapy, we've got that, but in specific, there's very specific behavioral recommendations. And I'm actually going to go over some of those. And it's really important to kind of know some of the unique aspects of it, and especially the unique aspects related to pacing for the recommendations. Okay. So here's just another symptom picture, of what this looks like. Okay. And some of the adjustment that is occurring for folks with all of this happening, and some of the orthostatic intolerance that they can have. Okay. So just kind of looking at this, no matter what lens we have and what the reason why we have an increased symptoms for our pediatric population since the pandemic, really need to be looking at this at a multidisciplinary approach, and really bringing out and talking about not only some of the changes that could have happened related to thinking about those MRI studies, right? Neuroimaging that we have since COVID, but also considering just what's happened in our world since then, and how all of those changes and pressures are actually being given an increase in pressure for our kiddos and changes in their environment. It's just not the same anymore. And especially how the pandemic actually increased some of the use of our devices, and some of the device, obviously, electronic devices. More school went on to using devices even more so. We've gotten rid of paper in most of our schools across the United States. Most of them don't even have, like pens and paper anymore. It's like literally walk in and get a device. And if we look at the research related to utilization, right, of electronics and how that's impacting our brain even more too, we can see that this is just kind of like a colossal impact for our kids, and how they're going to be changing and developing much different than we ever did in our generations. And unfortunately, we're seeing those changes in mental health, attention spans, all of those pieces. Okay. So just making sure that we're, keeping a recommendation to screen. SAMHSA actually put out a large recommendation of screenings when it comes to long COVID. I'm going to show them to you. I'll go through them really quick. But when you look at them, you're going to be like, wow, this is like I'm back in school in my assessment class, right? They put out this huge work group that they went for like 2 years and came out with this great assessments of this is what you need to do, but it's pretty big. It's like give everyone a back inventory and then do this, you know. So it's it's a little bit big. There are some obviously generalized screening pieces, but it's the same things we do with, you know, United States Task Force recommendations, right? Or PHQs or GADs, right? So you'll see with some of those on there too. But it is just important to kind of figure out the biggest thing we say is what are we doing to assess our ADLs, IADL, you know, and sleep for these kiddos and populations? Are we asking questions related to that? Or are we just concentrating related to mental health symptomatology, right? If we're not asking questions about just general activities of daily living, we might be missing a broader symptom picture here, or we might be just kind of thinking it's all just depression, and it really may be a broader systems change for this kiddo, okay? And so what's great is some of the results we've seen with doing very specific recommendations for treatment, and the recommendations for treatment haven't changed as far as its number one things are CBT, MI, right? So nothing, you know, different there when we're looking at it, okay? So some kiddos might need a little bit more complex, you know, recommendations and approach to care. And so just kind of, you know, thinking about that. Rehabilitative care has actually been something that's increased post-COVID. And so we're seeing a lot of folks being referred to cognitive rehabilitation and neuro rehabilitation than we have before. So it could be something to consider, you know, at various levels, especially if you have a kiddo with more of a complex picture. Okay. So here's a little bit of some of the recommendations that have come out for primary care providers. And in specific, this is a obviously federal recommendation that has come out. So, you know, like you see those and you're like, this is kind of what we teach all of our providers and our care teams to do. It's interesting that it took a federal designation to have listened to your patient's story and validate their experience. But you have to understand that a lot of folks still, as far as primary care and other type of specialty care scenarios, still are debating the presence of long COVID and still are debating whether or not it even existed, and still are debating what that symptom picture has done to that person in front of you. Is it really that, or is it just that they are unable or have had a difficulty with managing these other stressors that have happened in the past few years? Okay. So there's a lot of debate on it. And so these are the primary recommendations is actually you need to validate, because what we're seeing is most of these, you know, individuals that are coming in for care are just focused on very specific symptoms, right? And they're not really being listened to really be able to see the full symptom picture. Okay? So they're missing that, and they're being not validated to really disclose even further. Okay, so they feel like they're going crazy or that there's something wrong with them, you know. So here's some more tips. Again, these are very specific tips related to for primary care providers to really look at and ensure that they're doing screeners or they're looking at evaluating symptoms and looking at whether or not things are being exacerbated by other things that might be happening, okay? So we know, again, here's those tips for those primary care providers, nothing that you all are going to be shocked at, things that you probably already do in your care teams already, okay? But I'm going to talk about what those set realistic recovery goals really are for these kiddos, because that's really important. It's something very different than what we might think, okay? We do want folks to do sickness certification for these kiddos because we're seeing that one of the primary results is a lot of these kids are not going and attending school anymore, and they're switching specific to online school a lot. Good and bad with that switch, because we know bad, however you want to determine that, we actually could increase some of their other symptoms and their difficulties like socialization, right? Feeling confident, being out with others, right? Having relationships with others. And we actually could be increasing more other symptoms as well, like difficulties with sustaining attention without a lot of input, right? Because they're getting so used to these screen times. And so it's this kind of a mixed recommendation for folks. So I'm going to talk about the reasons why we want this SIG certification here in a moment for our kids with long COVID. Here's these tools. I think it's right, like it's like everything in the world they came up with. So this is the large scale, like 100-page report from the government that said, here's on long COVID. This is what you need to do and assess. It's like every neuro test we've ever been taught as psychologists in the end, and by functional domains, right? I was like, did you guys slap everything on the wall? But like, as you look, you're like, they really did. They really did slap everything on the wall, right? So I'm just going to flip through here again, like trail making. I mean, like the Wisconsin, I mean, everything's on here, right? So I'm just kind of, going through. Again, here's these recommendations. Nope, there's my cat. So all these specific pieces, clicker stop working. Here we go. Okay, so I'm just going to skip through so you can see again. Okay, all the promises on there. Okay, the sleep scales. Okay. And there's sleep scales, of course, for kids, but let's get to the heart of everything that we need to really be focused on and doing. Okay. And so there's very specific recommendations for kids and also obviously for adults when they're having these experiencing of increased symptoms related to long COVID. And one of it is pacing. So we know if they have complex kind of sequelae happening for these folks, that if we just go with our usual, like, let's get out, let's go for a walk, like, let's go into nature, right? Or let's do these very specific behavioral things. I want you to get up and do this very specific routine at 8 a.m. and then at 9, you can do this. We really have specific recommendations to make huge changes in that. And we need to look at our pacing in specific. So even with ABA for looking at our populations that have more developmental difficulties, we really need to look at pacing differences. So previously, sure, these kiddos could have gotten up, and maybe if they're experiencing mental health symptoms, whether it be mild, moderate to severe, we might really want to get them to be doing more activities of daily living, more getting out and, having time in nature or socializing. But honestly, we know that the increase in level of energy that takes actually impacts the other pieces of this sequelae and actually starts to increase their severity even more. So what they say is pacing needs to be about 1 minute to 2 minutes. So they're increasing in 2-minute intervals each week. So after a week of increasing in 2 minutes, then you can increase by 2 minutes again. So it is not like, other recommendations might be like, hey, let's get out for 10 minutes or get out for 30 minutes. Because in the past, this kid was playing sports every day, and now they're no longer even attending school. Okay. And so we can't say, let's get out on that soccer field for a half hour. They may be able to do that, but in 2 days' time, typically within 24 to 48 hours, they're going to see a significant increase in symptoms. So much so that they're having difficulties with getting out of bed. They have an increase in headaches and migraines, difficulty even sometimes with breathing. And then, of course, increase in suicidality and depression, anxiety symptoms. So it is really important. They're really pressing this pacing piece, is saying, I really identify from the kids and the family, how long are they engaging in very specific behaviors? So really getting a better history of this, and then being able to say, okay, so your kiddos getting up and being able to do, breakfast for how long, right? Okay, they're only engaging for 3 minutes with you. Let's see if they engage for 4, and let's actually put a timer out. We're going to talk to them about why this is important. We're going to talk to them about how we're going to do this time, and only increase it by 1 minute or 2 minutes. Okay. We don't want, when it comes with engaging and doing any type of behavioral recommendations, they say the biggest recommendation is to keep a kiddo in a routine, of course, but to keep them in there and not penalize for not being able to actually do or engage. So we want them to go to school. We don't necessarily want to penalize them if they can't engage in school. And that's where these sickness certifications are really important, is that we need to be educating the teachers, other personnel, to know this is going to look a little bit different when this kid is back in school, because we know the longer they're out of school and the more days they miss, the harder it is for these kids to actually ever go back to school. And we're seeing most of these kiddos with the significant symptoms of long COVID not going back to school. And if they are, they're going online now. And so they're doing, right, a very different picture. And it's not an online engagement like this, it's more of the online school of, hey, I have an assignment, I do it on my own. I can watch a video to learn something, but I'm not actually interacting with anyone. And so the recommendation is to try not to do that if we can. Of course, every person is different, right? And so we have to look at the larger, context for the person. But if we can, we want them to go to school and be there, even if it means that they're not really engaging in a lot of schoolwork during that time. If they can just go and sit, okay, and try to be there, and they're just kind of breathing and having a snack, and maybe they do one of the assignments in the day, that's really what we're looking at as far as that pacing. Okay, see how this is incredibly different than what we would do with our regular kiddos, especially in schools, right? And so you can still do reward systems, you can still do all that, but the difference is how you're pacing it is extremely different than before. They do see that if you're pacing it at that 2 minute, which is the 2 minute recommendation increase, that's gone very well for people. Okay, so that's a really good thing. Again, what we see is kiddos then being like, I was on the sports team, so now I went and played in PE because it was super fun and I felt good, I felt fine. And then 2 days later, they don't want to get out of bed, they don't want to go to school, they feel like they have a headache, they feel depressed, and they're starting to think that there is this correlation. Okay, again, right, this is part of the problem here, is we're making correlations based off of just what we're seeing in practice, not necessarily off of what we're seeing in huge amounts of research studies yet. Again, Recover really hasn't given us a lot of information yet, okay? But if we think about it in terms of what we've seen on some of those MRI studies, that would make sense too, because those are some of the recommendations that we make for individuals who have pretty significant TBIs or pretty significant changes related to significant severe PTSD symptomatology, okay? So all very similar, okay? We do have, recommendations for cognitive rehabilitation. Again, this is increases that we've ever seen for folks. Normally, we're not making those recommendations a lot, but we're seeing it more and more. Here's just kind of lab treatment. This is, again, recommended, okay, by the federal government. These are things that you can consider looking at, okay, in labs, okay, very specifically for folks. So again, most folks aren't getting anything. None of this is done. What they're getting is just symptom management, which is part of what we need, but we also need to know if there's anything else that's happening that could be influencing this picture here, okay? And again, taking antihistamines and other types of allergy treatments is becoming one of the #1 treatments for pediatric populations, along with some of our other types of SRI, SNRI medications that we're seeing, okay? Of course, we want to do relaxation, care management, case management, right, to really help. There are some very specific referrals out there for folks, hotlines, online systems that people can join and resources, okay? There's a lot out there if people are interested in any other info, okay? But those are the pieces that I really wanted to, let me get back to you all, go over, and I wanted to make sure that we have any time for any questions that people may have about this.
Wonderful, thank you. That was very informative and I think relevant. I know for me personally, that was like all new information, and just didn't know much about long COVID in kids, and what it may look like, and especially those kind of recommendations with the pacing. So yeah, let's open it up. We have a few minutes. If people have questions and comments. Jamil?
I was just going to say, thank you, Lesley. I was glad to hear you mention the issue around attendance at school and not being in school, because this is just really a problem. So many kids are just not in school, and being able to link it back to whether or not they had COVID and how long they've been out of school and how it snowballed into a bigger issue. So I think that question about asking about COVID and screening for some of that history will be an important thing to add as we see new kiddos.
Especially in schools that are really looking at truancy and their concerns, they really do need to be looking at and asking these questions, And again, that switch to online school, which is happening a lot, again, sure, we can see why, but it's also then contributing to more isolative patterns of behavior and more difficulties in other areas of their life. Amelia?
Yeah, I was thinking with this, are you like doing 504s with a school? Are you like advocating for them to get a 504 plan? Are you getting any
Yes, it
pushback?
is.
Because I feel like I'm getting pushback for really common things like ADHD.
That's that you're always going to have that.
Right. So I'm like, now I wonder if the
Yeah.
school is going to push back on this one for me. But
Yeah.
okay.
So, so folks, are eligible. So some kiddos can be eligible for certain types of IEPs or 504 plans based off of specific diagnoses. I would say always in my history, I actually operated as a school psychologist for about a year and a half while in school and grad school. And I would say always, and I did partial assessments, right? But I don't think I've ever had like a school district who's like, oh, like we welcome that and we're good with our timelines. And there's so many difficulties that they are managing related to funding and then lack of services, right? It's the same thing that happens in primary care where they're like, don't screen because we don't want to know because we can't do anything about it, right? It's the same kind of balance that occurs. It is a formal official diagnosis at the federal level. So that actually gets full disability services. So it is a viable diagnosis that you can use 100%. But sometimes it's educating them on that, especially if they haven't seen it a lot. And I would say that I think most people aren't going in and doing this. Anytime I've worked with kiddos, and I've worked with a few that have these symptom pictures, and talk to the medical sites, what we're seeing is that nobody's actually going in there and making that. I'm seeing more and more the switch over to online. And that's what's happening the most that I'm seeing. And, and the parents are like, it's online, like, we're doing this, it's going to support the kid. They want it. This is going to be great. And, at the same time, you're like, I definitely can see value in it. But then here's the other problems that I also foreshadow is going to happen. And unless you're putting in a lot of other time to do other types of rehabilitation for this kid, socially, emotionally, this kid is going to have a very difficult time being able to then enter into the world in a different way and being online. Does that make sense? Just even moving, right? Because we know that the sequelae, the picture here isn't just, okay, anxiety, depression symptoms alone. It's actually impeding their ability physically to get up and move and has lots of types of dysregulation in their body. And so then they feel uncomfortable, which increases their anxiety, depression, right? Like how it works. So now they're sitting most of the day and so all those symptoms are actually increase even more. So then they get worse because they're not, rehabbing. So yeah. So it's hard.
See that we're at time, but we appreciate this this presentation and the resources that you're sharing with us. So thank you again.
Yeah, you're welcome. And then Rachel, should I email you?
Yes.
Okay.
Yeah, that would
I'll
work.
give you the stuff and so that you can have it and send it out to everybody if they're interested in any of it.
Yeah, that would be
Okay.
wonderful.
Yeah. Well, thanks
Awesome.
everybody. Thanks for having me.
Thank you so much.
Thank you. Have a great day, everyone.
Thank you.